Welcome back. We've got one more really interesting interview for you tonight. As if cancer and the cancer journey isn't difficult enough, an added challenge that many patients go through is the process of losing their hair due to chemotherapy. Researchers, however, at Michigan State University are working to minimize that side effect of treatment. I'm joined virtually by Dr. Brian Smith, who worked on a shampoo-like gel that will hopefully one day help prevent hair loss in cancer patients. Brian, thanks so much for being here with us tonight. This project is fascinating to me. Let's start kind of at the beginning with where this idea came from your perspective.
Thank you. Yes, thank you for having me. I think this actually came from a design process I learned while I was a trainee at Stanford University, where essentially the idea can be kind of encapsulated in the concept that a well-characterized need is the DNA of a great invention. And so it's a process where essentially we discuss directly in the clinic with doctors, nurses, former cancer patients, and really try to understand the need, to really understand what that need looks like and characterize it before we even invent a solution. And I think that's kind of the secret of why we identified this need and figured out an appropriate solution for it.
I think that backstory to it is really interesting. And so I know this is a very complex process, but I'm sure you've got a great way to explain it in a bit of simpler terms. So this is a gel-like or a shampoo-like gel that patients can be using to minimize that hair loss, which we know so many people deal with when they're dealing with chemotherapy and those drugs are pumping through their system. How does this work? What would this look like, if folks were able to use it one day?
Absolutely. So the way it works, the way we designed it to work was to mimic. There's only one FDA approved treatment for chemo-induced alopecia, which is this hair loss due to chemotherapy, and that's cold caps. And what that is there's literally these very, very cold caps that sit on a patient's head, and it turns out that they're quite expensive. And not only that, but they cause a lot of pain. They hurt. Some patients apparently even get to the point that they need narcotics to overcome the pain. Not the pain of the chemotherapy, the pain of the cold cap on their heads, right? So expensive, painful, and works somewhat well. And so what we wanted to do was we wanted to decrease the bad parts of that. We wanted to make sure that it was not so expensive to kind of democratize that process, and would be able to limit the pain and either minimize or completely eliminate the pain. And the way that those cold caps work is they shrink the blood vessels in the scalp in order to limit the amount of chemotherapy while it's circulating in the vascular system, to decrease the amount of drugs that actually leak into your scalp area and actually affect your hair follicles. And so we did that pharmacologically, meaning with drug molecules. And so we developed a hydrogel that had the ability to release these drug molecules at a very steady rate over a period of hours into the scalp, that would contract your blood vessels only in the scalp, not in the rest of your body. So that would essentially mimic the mechanism of action, decrease the amount of drug that would get to your hair follicles, and therefore be theoretically as good as a cold cap, but eliminate those issues. And to make it also easier for the patients, we designed this hydrogel. Its consistency, its ability to kind of cling onto the hair, to be appropriate at body temperature. And then if you make it a little bit cooler, a little bit colder, you could potentially then just wash it off whenever you're done with it, right? After your chemotherapy session, or some chemotherapies might last a little bit longer. You might want to leave it on while the chemotherapy is still circulating in your system, and then wash it off once you're assured that the half-life of that chemotherapy is sufficiently over.
Yeah, I think this is just fascinating. I've heard of the cold capping before, and as you mentioned, that can be painful in its own way, but losing your hair is also something that's so difficult for people to go through. And so hearing about this option, that would not be painful in any way is just fascinating. At this point, this isn't something that people have access to just yet. What does the process look like as having this as an item that someone could get their hands on to use if they're going through chemo?
Yeah, so we basically need to talk with regulatory agencies like the FDA, and we need to hear back exactly what needs to be done. So, do we need to do another animal study? And we don't necessarily expect that we will, because all of these components are established. They have either been on the surface of or inside humans before individually, not together. So, we would have to get approvals to go to human clinical trials. So the first step is to get those approvals. And the second, just as important step is to get the money, the funding to allow us to do that. Because, our previous funding only allowed us to do this, to develop the gel, to do some initial testing in the lab. Now we're going to need funding to actually put it into humans to allow people to actually test it out, and then ultimately to use it once it's hopefully approved at the human clinical trial level.
Yeah, absolutely. I know there's a lot of hurdles to jump through. Obviously, funding is needed and then all of those regulatory processes. But this would be so exciting to be able to offer to people when it comes to, you're on the side of things that you designed this and you've seen it work and you're hoping to, see it continue to work with actual patients in the future. What do you just hope besides the physical outcome of not losing the hair, but the emotional outcome for people who could use this one day soon? What are you looking forward to there?
Well, I think that I would separate cancer patients into maybe three different categories, right? There are cancer patients who are, just so scared for their lives, they don't care about their hair, and more power to them. I totally understand that mindset. They might not care about such an innovation, and there are a certain segment of cancer patients who are like that. There's another segment of cancer patients who are scared about their hair loss, and they go through the treatment anyway because, of course, you want the best treatment to save your life. It's just an unfortunate side effect. And then third, there is a relatively smaller segment of cancer patients that I think I've seen somewhere in the range of 5 to 8%, it could be more, that actually care, when they hear about a cancer diagnosis, their first reaction is, will I lose my hair, right? That's one of the first questions, if not the first question. And I wasn't aware of that before I started talking to former cancer patients and nurses and physicians, that this was actually an issue. So it turns out that some people actually select their treatment plan, their treatment regimen on the basis of whether or not they're likely to lose their hair. And what that means is that it turns out by changing this paradigm of who can get access to a treatment that could actually overcome hair loss, you can actually tell them that they're not going to lose their hair. They're very likely not to lose their hair, and you can literally improve the efficacy of their treatments by allowing them options that they wouldn't previously have actually selected. So emotionally, to me, I think it's a big deal to give people that social ability to professionally and personally not feel like a cancer patient. So that's huge. But what's really special to me that I didn't expect when I first started this project was that it can actually affect cancer treatments because of the social side of how people select what they choose to use to treat their cancers. So it
Absolutely.
really is, to me, it's very important, and I feel privileged to be able to hopefully help cancer patients out in that way when we're hopefully able to bring into the clinic.
Absolutely. Well, Dr. Brian Smith, thank you so much for talking about this. It's so fascinating to learn about this, and I wish you the best of luck when it comes to jumping through all those final hurdles to get this to a place where patients could be using it one day in the future. So thank you so much for your time tonight. We really appreciate it, and best of luck with the processes in the future.
Thank you so much. Appreciate it.